All right, welcome everyone. This is Dr. Clark from the Center for Weight Loss Success, and today on Losing Weight USA, we're going to talk a little bit about vitamins. Some of the vitamins that are important for weight loss, but literally just kind of vitamins overall. We'll go through each of the different vitamins, a quick overview of the important vitamins and minerals, which can be especially as we get into the winter months, but also kind of during a weight loss plan. All right, welcome to Losing Weight USA, real-time answers to your weight loss questions. So the latest research as well as a little bit of expert advice gives you direct access not only to me, but you should be receiving health tips and recipes via the membership portal. And I encourage you to get into the membership portal. We keep updating that. That's where you get all these webinars, but also behavior modification classes, recipes, all kinds of stuff in there. Each one of these webinars will last about 30 minutes or so. If you have questions, just type them into the chat box as we go along. We'll get to them at the end. If you think of things once we're all done, just give us a yell here at the Center for Weight Loss Success. Email is success@cfwls.com. Phone number 757-873-1880. As well as we are in our new space. Come stop by and visit us at the nutritional store. We're at 711, that's 711 Brick Kiln Boulevard in Newport News. All right, so let's get started. And let's see if I can flip these slides over somewhere. Here we go. Yeah. All right, we got it. All right, so kind of a little overview of what we're going to talk about. We're going to talk about all the different micronutrients. Okay, so we'll kind of talk about those micronutrients, the vitamins and minerals, which ones are key, what makes up a good multivitamin. And we'll also mention a little bit pharmacy grade versus over the counter. And just as a generality, I do discourage using generic vitamins. You just really don't know what's in them. And then finally, what do I recommend that people typically take? All right, so kind of just as an overview, vitamins and minerals are kind of these tiny little molecules, phytonutrients that your body requires in very small amounts, but they help keep you functioning properly. And so they're referred to as micronutrients, as opposed to macronutrients, which are basically what provide calories, energy. So that's the fat, the protein, the carbohydrate. So those are macronutrients, the vitamins and minerals that are micronutrients. And vitamins are essential non-caloric nutrients that assist your body in biochemical equations. And they basically, what they do is they tend to make all these biochemical equations run more efficiently and effectively. Okay? Now, minerals are also needed in there. Minerals typically, they're on the periodic table type of thing, if you remember your chemistry and all. But minerals are elements also needed by your body. Okay? Most of these then can be obtained from food. Okay, so pretty much we can obtain them from food. The vitamins themselves can be divided into two groups. We refer to them as water-soluble vitamins, which are the B vitamins, as well as vitamin C, and then fat-soluble vitamins. And that's vitamin A, vitamin D, vitamin E, and vitamin K. So those are two broad groups, and those are our vitamins right there. So I'm going to first kind of hit on kind of what are these vitamins, what's their importance there. We'll start with the fat-soluble vitamins. Fat-soluble vitamins, again, are vitamin A, vitamin D, vitamin E, and vitamin K. Okay. Vitamin A, if you remember, vitamin A, people talk about carrots for your vision. Okay, so they are very important in vision. So they help maintain your eyes, but also skin, bone, teeth. They're needed for growth. They're needed for your immune system. So they help with kind of fighting off any types of infections, inflammation. They're very important for your overall immunity then. But the big thing to think of is it's vision. Okay, that's the one that people think of when they think of vitamin A. Vitamin D is an extremely important vitamin, and with vitamin D, at least half the American population runs low on vitamin D. Literally, the more you weigh, the more likely you are to be low on vitamin D. So there is a direct relationship with weight in that, well, I guess an indirect relationship with weight. When vitamin D levels are low, people tend to be more overweight. So it's really important when people in a weight loss plan are trying to lose weight that I think it's very important to get extra vitamin D. Now, vitamin D is especially important in bone mineralization, as well as it helps you absorb calcium. So those two, calcium is very important in bone formation then too. But vitamin D also does lots of other things. Helps prevent certain cancers. It helps prevent heart disease. It helps in preventing or treating neurological and psychological problems. So if you have low vitamin D, you're actually at a higher risk to develop any of these other problems. So that's even more reason that, gee, most people should be on extra vitamin D. And I encourage people to typically take a good 5,000 units a day. All right. Now, just a little generality about fat-soluble vitamins. In theory, you can overdose on fat-soluble vitamins, but it's incredibly difficult to do. So it's not like, gee, I take 2 of them and I'm overdose. It's like, no, okay, you'd have to take, bottles and bottles and bottles of them typically. Right? Vitamin E is a really important antioxidant. So when I talked in one of the webinars about antioxidants, phytonutrients, vitamin E came up in that. But it's a very important antioxidant, and it protects our cell membranes. So every cell in our body, like trillions and trillions of cells, 100 trillion or so cells that are in our body. It helps protect the cell membranes, but also helps reduce tissue inflammation then. So if you've got any type of inflammatory conditions, then extra vitamin E can be helpful too. But it's a very important antioxidant. Okay. Vitamin K is probably one of those vitamins that doesn't get as much airplay or much hype as it needs, because vitamin K is extremely important, one from a blood clotting perspective, but also to prevent abnormal bone formation, which is incredibly important for anyone who's prone to osteoporosis. So osteoporosis is a very common problem as we age. Okay, more common in women than it is in men, but still very common problem as we age. But vitamin K is extremely important. I mentioned the vitamin D helps absorb calcium. Okay? And the calcium is important in bone formation. Well, vitamin K helps put that calcium in the right spots. So the issue there is, yes, we'd like to absorb the calcium, but we'd also like to put it in our bones. We don't want to have it deposited in our blood vessels, which is kind of hardening of the arteries, arteriosclerosis. It can have calcium deposits. And if you've heard of people getting like calcium scans, looking at see if there are calcium in their heart muscle, it's along the vessels that they're talking about. Well, vitamin K is extremely important in preventing that from happening. It helps build the calcium where you need it in the bones. It helps keep it out of where you don't want it, which is in the blood vessels. So vitamin K, very important. There's actually 3 types of vitamin K. I won't get into too much detail, but it's actually vitamin K2. That's the important one. So why do I harp on this? Because obviously, if this is something that can affect everyone, but also just taking the vitamin D all by itself without enough vitamin K, you're really not doing yourself that much of a favor. You're getting that vitamin D, which helps absorb the calcium, but if the calcium is then deposited in the wrong spots, that could be problematic. So yes, I do encourage people to take extra vitamin D. You need it, but you also need the vitamin K, which is one of the reasons why our vitamin D supplement we have in the nutritional store here is that we have extra vitamin A and vitamin K with it, because it's those 3 vitamins actually work in synergy. They work in synergy. None of them can do everything it needs to do without the other ones. So vitamin A, vitamin D, vitamin K, very important. They work in synergy then. All right, so that was the fat soluble vitamins. The water soluble vitamins are vitamin C and vitamin B. Now, B vitamins, there's actually 8 different B vitamins. All right, so we'll get that in a second. Vitamin C. Vitamin C, I also talked about in that antioxidant discussion, because it's a really important antioxidant. And it's an important antioxidant that really helps maintain connective tissue, which also supports the immune system. It boosts iron absorption. There are lots of things that vitamin C does. So if you run anemic and you need to take extra iron, taking it with vitamin C, which is a water-soluble vitamin, so you can actually take very high doses, will help absorb the iron better, as well as the immune system. We talk often, or you hear people talking about, gee, vitamin C to help prevent getting colds in the winter. Yes, that helps because vitamin C supports the immune system. But a very important thing too is it helps maintains connective tissue. So if you're familiar at all with the disease scurvy, which we don't see nowadays, but back 100 plus years ago, 200 years ago was very common, especially in sailors that wouldn't get any fresh vegetables, fresh foods, that type of thing. And they figured out, hey, if they had some oranges or limes, that's sort of British limey, came from the term there, is that they could prevent scurvy. Scurvy is a deficiency of vitamin C, and what would happen is all the connective tissue that was holding your joints together, any old connective tissue that, scar tissue tends to be connective tissue, so where previous injuries or cuts where it would start falling apart. Vitamin C, very important in maintaining that connective tissue there. So the water-soluble vitamins are very important as well, not just the fat-soluble vitamins. Now, the other important water-soluble vitamin is B, vitamin B. And B vitamins we often refer to as the 8 of them together as B complex. Okay, and I think I recently did a little video on B vitamins as well, so look that up. But B vitamins are very important. There's 8 of them. They don't necessarily go in the right, we think of B12, we think that there's got to be 12 B vitamins, right? There's a B12. Well, what happened is they originally thought certain elements were actually B vitamins, and they weren't. And therefore they got pulled out, and therefore there's only 8 B vitamins, even though it goes all the way up to B12. Okay. So the B vitamins are thiamine, niacin, riboflavin, folate, B6, which is pyridoxine or pyridoxal if you get it in the active form, B12, which typically everybody knows about B12, that energy vitamin, biotin, and pantothenic acid. So I didn't put them in the right order there as far as numerically going up. But they basically, we refer to B vitamins as your energy vitamins, and they do aid in energy metabolism. So they help the body metabolize carbohydrates, protein, and fats. Okay? And so they're very important in energy metabolism, and therefore kind of that nerve function as well. So your brain, all peripheral nerves, and if they have any problems with numbness, tingling, different nerve abnormalities, energy level, B vitamins can be very helpful. B12 we refer to as the most important one, but they're all important. So the symptoms of low B vitamins or B vitamin deficiency include a lot of vague terms. Gee, I'm tired, I'm fatigued, I'm exhausted, I'm a little irritable, I'm anemic because of B12 deficiency, you don't make red blood cells as well. Depression, forgetfulness, loss of appetite, skin problems are fairly common, as well as then impaired immunity. And you'll notice that most of these vitamins have a lot of overlap. I mean, they help in many of the same things. Okay? And that doesn't necessarily mean one's so much more important than another one. But the B vitamins, you got to think of them as our energy efficiency vitamins. And it's sometimes people think of B vitamins give you energy. Okay, B vitamins do not give you energy. They make the energy producing systems or equations run much more efficiently. It's kind of like the oil in the car's engine. Okay, the fuel, the energy comes from gasoline, or if you're got an electric one. It comes from plugging in and getting the electric battery charged up. But all of them still require oil. And kind of oil in the machine, in the engine, makes it run much more efficiently, effectively. That's what B vitamins do. They make the energy, they don't actually physically give you the energy, but they make all the energy producing equations run much more efficiently. All right, let's see. So minerals. So we talked about a little overview of vitamins. Minerals then. Minerals that are just, they're inorganic, they're non-caloric, there aren't any calories in there, in case you don't get energy from them again. So they're inorganic, so they're on the periodic table. Non-caloric substances, but your body requires them in small amounts to ensure proper function. They tend to perform a number of absolutely essential duties, which includes maintaining water balance, assisting in muscular contraction, transmitting nerve impulses. So they do all kinds of essential things. They aid in those things. So they need to be an appropriate level. So often if you go to your primary care physician and they draw some blood work, they do some lab work on you, they will often check a number of these minerals. What are their actual levels then? Okay. Some of the more important ones, I'm not going to hit every single one, but some of the more important ones I mentioned earlier, I mentioned calcium. So we're going to talk about calcium, phosphorus, magnesium, sodium, potassium. Those are the big ones. Then we'll talk about some other minor ones that are also still very important. So calcium is really important in bone formation. Obviously, we wouldn't have our bones if we don't have any calcium. Same thing with phosphorus. It's calcium and phosphorus. Basically, that's what concrete is made from. So bone mineralization, very important to have calcium and phosphorus. The calcium is also important in just water balance. How much water we retain or don't retain, how much water is in our body. And if you think about it, more than two-thirds of our body is water. Okay? So subsequently then water balance, water regulation is extremely important. Calcium is a big part of that. But it's also very important in muscle contraction. Okay? If people have very low calcium levels, they can go into tetany. The muscle just kind of tightens up, all the muscles tighten up, you go into tetany. That's what the disease, tetanus. Okay? Tetany just means all the muscles contracting at once, which obviously not a comfortable situation there. Life-threatening, actually. So calcium is also important, muscle contraction, but also the relaxation. It's important in maintaining our blood pressure. And part of that is because the smooth muscles of the vessels are related to the calcium. That's how some of a calcium channel blocker tends to work to help lower blood pressure. The calcium channels and help keep the tightness in that can maintain your blood pressure at a certain level. But it's also important in secretion of essential enzymes and hormones too. Calcium, very, very important. Phosphorus, also very important, especially in bone mineralization as well as energy metabolism. Phosphorus is we talk about what's the money of energy. It's ATP. ATP stands for adenosine triphosphate, which is phosphorus. Okay? So phosphorus is important in every single energy producing equation throughout, as well as bones. Okay? Magnesium. I'm a big fan of magnesium and taking extra magnesium. Actually, just about everyone could benefit from extra magnesium. The qualifier on that statement is if you have bad kidneys, your kidneys don't function quite normally, then you have to be very careful adding extra magnesium. But for most people, they can benefit from extra magnesium. And it's just, again, very important in bone mineralization, but also just everything that's involved in protein synthesis, enzyme activation, muscle and nerve function. Magnesium is a muscle relaxant. Okay. It's also important in immune function. Magnesium, I'm just going to digress here for a minute, that magnesium is very important, but if you draw your labs, typically, if you get your magnesium level checked, it very likely is completely normal. So it's completely normal. So why would I need extra magnesium now? Because the issue isn't so much how much magnesium in your bloodstream. Your body will maintain that. So you get so depleted that you can't function. So your body will maintain. So very likely the magnesium in your bloodstream is going to be normal. It's in your tissues, though, that you need it, especially in the muscles. And it's extremely important. So most people can benefit from extra magnesium, but it isn't because, gee, I got my lab checked and I have low magnesium. Okay, now you might, okay, and then you absolutely should be on extra magnesium. But typically, yep, it often is going to be normal, but it's not your bloodstream that we're worried about. We're really worried about in the majority of the tissues, especially the muscles. All right, sodium and potassium. Sodium, potassium, we die without sodium. Sodium is salt. Okay, we die without salt. Salt used to be kind of, used as money almost because we would die without salt. But sodium is very important also maintaining our pH balance. pH is our acid-base balance in our body. And it's essential in muscle and nerve function, and it also regulates our body water. So the more, if you have too much sodium, retain water. Okay? Now, typically you talk about, especially if you're on a low carb diet, you should actually probably add a little bit of sodium. Because if you're on a high carb diet, which typically you puff up like crazy on a high carb diet, it's because you retain sodium. But if you're on a low carb diet, you won't retain sodium, therefore you need to replace it and actually need to probably take in extra sodium. If you're on a high carbohydrate diet, you probably need to restrict your sodium. Potassium, kind of very important also in muscle nerve function, but also just like sodium helps maintain fluid and electrolyte balance. Okay. All right, so other minerals. We talked about some of the main minerals. Okay, what about the other minerals? Things I've taught and I mentioned probably in other webinars: iodine, iron, zinc, chromium. Okay, these are very important minerals, but you don't need nearly as much. Iodine is absolutely essential, and iodine is also one of those things that most people don't get enough of. And the amount of our iodine that supposedly you need is much lower than what the optimal dose of iodine actually would be. Iodine is essential. We talked about this in our thyroid discussion a few weeks ago. Absolutely essential in thyroid hormone regulation. And it's certainly, and thyroid is absolutely responsible for regulating our overall metabolism. So without iodine, your metabolism is nothing. Okay? So most people also can benefit from extra iodine. Okay? That's often in thyroid support type of products as well, as you can get extra iodine. Iron is extremely important in maintaining our blood cells. Okay? It helps carry oxygen in our blood and is required also then for energy metabolism. Iron deficiency is probably one of the most common nutrient deficiencies there are. And the symptoms, fatigue, weakness, impaired immunity, relatively vague things, much more common in women, and part of that's because they're in monthly cycles, okay, but also can happen in men as well. Iron deficiency is extremely common nutrient deficiency. And that's part of the reason why a lot of multivitamins will have extra iron in it. And literally the definition of a woman's multivitamin is they've added extra iron into the multivitamin. And that's why it made it a woman's multivitamin. It's because they tend to lose some iron their monthly cycles. All right, zinc. Zinc, we think of immune function. Anytime, to avoid colds, the cold ease, all those formulas out there to help relieve colds, they have extra zinc in it. Okay, they can be lozenges and things like that. So zinc is also very important to activate enzymes. Enzymes help keep, again, all those biochemical equations going, but also that aids in immune function. So you hear about zinc all the time. We talk about keeping away, viruses and colds and things like that. Zinc is very important there. And you get it, extra zinc literally anywhere. They come in lozenges. Chromium I talk about intermittently because it works closely with insulin to help regulate our blood sugars. Okay, chromium helps smooth over blood sugar levels. So you don't tend to get, for especially if people are really prone. Some people are extremely prone to getting really highs and lows, great big blood sugar swings. Chromium helps smooth over blood sugar swings. And by smoothing over blood sugar swings, then it actually helps with cravings. So chromium can actually be very helpful for people that tend to get a lot of cravings. Okay. But it works closely with insulin to help regulate and release energy from glucose. Then. Low levels of chromium basically impair insulin activity. We talk about insulin resistance almost weekly. So if you've got low chromium levels, your insulin resistance is going to be a lot worse. Okay? So then chromium is another thing. Gee, many people can benefit from extra chromium. Okay? All right, so kind of talk about kind of some of the minerals, the vitamins there, just kind of a quick overview of those. So what components and what makes up a good multivitamin? Okay. A multivitamin supplement should provide all those vitamins in doses and some of the minerals too. Now, hard to provide all the minerals. Minerals have size to them. So sometimes we wonder, well, why can't you put just extra calcium in this? Because calcium, some of these minerals, they have size to them. And subsequently that makes a pill that's 3 rounds of baked potato or something along those lines. So that won't work well. So, but a multivitamin should provide all the vitamins in doses that are close or exceed the RDA. Now, the RDA is the recommended daily allowance. All right. Now, just realize when we say RDA, recommended daily allowance, the definition of RDA is the absolute minimum amount of that vitamin, which will prevent a deficiency syndrome. So it has nothing to do with what is actually the optimal dose of that vitamin or mineral. So just the fact that we say, gee, it's got the RDA, I'm getting the RDA of whatever vitamin or mineral. It's like, well, you're taking the absolute smallest amount. That'll help prevent a deficiency actually in just most people, not all people. Some people still get a deficiency with it. So the RDA, again, has absolutely nothing to do with what is an optimal amount. Nothing. So keep that in mind. The flip side of that, so I guess the point of that being is that you can actually take multiple of the RDA and be at a better level. So it's typically, you're not going to overdose. Of course, the flip side of that is taking, 5 or 10,000% of the RDA is probably not such a great idea either. All right, so multivitamin should have at least the RDA of these vitamins and some of those minerals too. Okay? Typically, you can't put too much of any one or a couple of minerals because it would make a vitamin too big. They have size to it. So you have to take it as a separate thing, separate extra calcium, extra magnesium. Take that as a separate. There'll be some in a regular vitamin, but generally relative minimal amount. All right, so pharmaceutical grade versus over-the-counter vitamins. Is there a difference? Okay, pharmaceutical grade vitamins just means they are made under the conditions set forth by the American Board of Pharmacy. So they're made out of made under the conditions that are the same thing that drugs are made out of. So a pharmacy that makes whatever drugs they're making are using the same type of setup that they're actually doing these vitamins in as well. So it pretty much guarantees that you're getting the cleanest. There aren't other things in there that shouldn't be in there. You're getting the right dosing. So you can trust it as far as the content that's in there for the best absorption and best utilization. Again, that's pharmaceutical grade vitamins. Typically, you pay just a little bit more for some pharmaceutical grade vitamins. Typically not a whole lot more, but a little bit more, as opposed to over-the-counter vitamins. Over-the-counter vitamins are not held to the same standard. And studies that have been done on a lot of over-the-counter vitamins show that the content may not actually match what's on the label. So even though you may look at, hey, I got this pharmaceutical brand vitamin sitting in front of me. I got this over-the-counter brand. The labels are looking very much the same. I'm just going to buy the cheaper over-the-counter, generic, whatever. But you may not be getting the same thing. Because one, nobody checks it, okay? And the content may not match what's actually written on the label. So that doesn't mean you shouldn't use over-the-counter vitamins. What I do encourage you to, if you're going to use over-the-counter vitamins, is use a name brand, meaning that here's a company that they've done this for 50 years or so, and this is what they do. They made their name on this quality vitamin, as opposed to getting the generic Walmart brand. I don't want to pull out Walmart because they doesn't mean they don't have pharmaceutical grade. They can, but a lot of the generics out there, literally, you have no idea where they were made, who made them, what the conditions were they made them in, what else may be in there, from rat hair to whatever, and that shouldn't be in there. And then does it actually have the things that it says should be in there? You don't know. And I discourage the use of generic vitamins. All right, so what do I recommend? I'm going to finish this off. What do I actually recommend? I do recommend just about everybody ought to take a multivitamin. And the typical American diet just isn't that great a diet. Even if you're doing your best to eat a healthy diet, often even the whole foods that we get, the non-processed foods that we get that came fresh from the field, the organic or whatever, because the soil has been depleted over years and years and years and years, they may not have all the vitamins and minerals that they did 25, 30 years ago. Okay? So even if you're doing your darndest to kind of, I'm getting out and eating whole food, or eating very healthy, you still very likely can benefit from multivitamin. Now, at least half the population runs low in vitamin D. The more overweight you are, the more likely that's going to be true. So that some of my surgical patients, it was probably 95% or more ran low in vitamin D. So multivitamin, is about everybody can benefit from vitamin D. With the vitamin D, it's best, again, the A, D, and K work in synergy. Okay. And next after that, I probably didn't put this in right order. I think most people can benefit from extra magnesium. Extra magnesium there, again, you need it in the tissues. But other things that are potentially helpful, essential fatty acids, which we didn't really talk about that. We talked about it different. We talked about the fats, but essential fatty acids can be helpful. B vitamins themselves, you can't overdose on B vitamins. They can only help you, and some people benefit from B vitamin injections. Okay? But B vitamins can be helpful. Other things that can be helpful, if you tend to be osteoporotic, extra calcium, blood sugar swings, extra chromium can be done, poor thyroid, extra iodine. If you tend to run anemic, extra iron. And then potentially if you're looking to help with kind of keeping your blood sugars decent, trying to lower the carbohydrate intake, a carb blocker, we've talked about that in the past, potentially can be helpful as well. And we have all these things at our nutritional store as well. If you're looking kind of, if you've had surgery and struggling a little bit, we have that Back on Track. We have Back on Track digital program as well. We have the book in the store, or you can get it on Amazon as well. All right, so vitamins and minerals, extremely important. That's just a kind of a quick overview of the most important ones. Okay, and kind of, but if there are questions, I encourage people, call us up, send an email, whatever, stop by and help you in the nutritional store as well. I don't see questions sitting out there at the moment. So, but if you think of things, again, you know where to find us. Our new address, again, 711 Brick Kiln Boulevard, Newport News. We're right on the corner of, right on the edge of Kiln Creek, that whole development that's in Yorktown, Newport News, as well as it's right near Jefferson Boulevard as well, Jefferson Avenue. All right, very good. Little reminder, stop by, get your body count done. Log into that membership portal. You should be receiving the health tips and weekly recipes. Tune in each Tuesday, 12:15 for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good day, everyone. Take care.